Hello, how are you, ladies and gentlemen? In this session, we are going to learn about mental disorders across our lifespan, and we are going to understand the different mental health concerns during childhood, adolescence, old age. We shall also examine other mental disorders in our adult life, and then the legal aspects that are concerned with mental health. So, without further ado, let's look at the childhood and adolescence mental concerns. So, in this stage, we are concerned with the most common diagnoses, which are always attachment disorder, to do with secure or insecure attachment. So you can imagine that if there is insecure attachment, then there is always going to be attachment disorder. And we talked about it when we were looking at the mental development theories, where we said individuals that benefit from secure attachment or whose parents care for them during childhood, they always develop into emotionally stable individuals, while those who do not have that secure attachment always end up having that emotional instability. So we also have other diagnoses in childhood and adolescence, like autism, which is concerned with difficulty with communication and socializing with people, but also in coordinating movement. So, an individual with autism will always find a problem with communicating and socializing or being around with other people, and it is common amongst children, but also it can go on to affect your adulthood. Asper, Asperger's disorder is also another form of the autism spectrum disorder, and it also is concerned with uh, difficulty in communication and socializing with the people around you. Then opposition defiant disorder is also common in children below 8 years, and this you will find that children with this disorder have a problem with following orders from people who are above them in age, or people with authority around them. This could be teachers, this could be parents, or their elder brothers or sisters. Whenever they tell them something, they are always defiant, or they are against the rules, they go against the rules, or do not obey what the other people are telling them, especially the people in authority or the people that are above them in age. Then attention deficit hyperactive disorder is concerned with inability to be attentive, being unstable whenever you are in an activity that requires attention. So these people will always have a problem with learning, concentration in class. And then we also have depression, which is that persistent feeling of being low, being empty. We shall expound on this later in this session. And eating disorders can also be common in childhood, but also in adolescence, and can lead to problems with obesity, problems with appetite. Trauma, or what we are calling PTSD, is related to traumatizing events that you can face in your childhood, whether they are physical, sexual, psychological. So when these traumatizing events happen, people tend to have PTSD, or what we call post-traumatic stress disorder, which we are going to also look at in detail as we go on in this session. Other diagnoses include childhood schizophrenia, and also schizophrenia is going to be looked at later in this session. Then suicidality deals with that feeling of wanting to harm oneself or killing yourself. Deliberate self-harm is also common in especially adolescents who are unable to identify the, their true identity, or to resolve that stage of identity identity formation or identical confusion. So if you're confused about your identity, you do not know what you really want to become in future, then that can be those problems of deliberate self-harm, where people engage in those activities which can harm themselves, and including drug abuse, unsafe sexual intercourse, and also can end up committing suicide. Then obsessive compulsive disorder deals with that disorder that is concerned with being obsessed about things like germs. You feel anxious about getting a disease, so because of that you want to you want to be extra clean. You want to be in a place which is devoid of germs, and you feel very anxious whenever you are in a place that you think might be contaminated. So that obsessive compulsive disorder is also a problem in childhood and adolescence, but can also go on to affect your adult life. Personality disturbance deals with those personality disorders that can occur during this stage, and we are going to expound on these personality disorders later in this session. We are also going to look at anxiety, and then we have pyromania, which is concerned with obsession with fire or setting up fires. And so those individuals who are always setting up fires out of the blue, without any reason, they are obsessed with starting fires, setting ablaze some things, uh, burning some things to create fires out of nowhere. Those are individuals having this disorder called pyromania. We also have sexual and emotional abuse syndromes, and these could arise due to those traumatizing events related to emotional abuse or sexual abuse, like rape, defilement, and other sexually related traumatizing events. So, mental disorders in children and adolescents typically affect the way they learn, the way they behave, and the way they handle their emotions. Like we are saying, some of those disorders, for example, ADHD or the attention deficit hyperactive disorder, will affect the way your child or your children learn, because during learning you require to pay attention. So if this disorder is affecting your ability to be attentive in class, then you will have a problem in learning. Okay, then behavior, because you want to respect the people in authority. So if you have disorders like the opposition defiant disorder, then your behavior will be of question. Then the way you handle your emotions, if you are talking about anxiety and you're not able to handle your emotions because of having anxiety disorders, then you are also going to be having a problem. So in children, we are looking at from birth up to around 10 years before they go into adolescence. We always have problems like attention deficit hyperactivity disorder, what we are calling ADHD. We always have anxiety problems, behavior problems, and depression, which are the most commonly diagnosed mental disorders in that age group. Then, when we look at adolescence, which is around 10 years to 19 years, and even those young people from around 10 to 24, always have issues of depression, substance use, suicide, being the most commonly pronounced mental disorders. And according to the World Health Organization, suicide alone is the fourth leading cause of death among individuals who are 15 to 29 years. Okay, so this is why mental health is really a big concern. If suicide or taking your own life is the fourth leading cause of death, this is something that as public health professionals we need to be concerned about. What can we do to change the fate of these young people? So the risk factors of mental disorders in these age groups include insecure attachment in childhood, like we are saying, according to those theories, especially the theory on attachment that was proposed by Bowlby and Ainsworth, which emphasizes the need for secure attachment. So when a young child is growing up, they need that emotional attachment by the parent or the caregiver. That primary caregiver is very essential in shaping their mental health. Okay, so that attachment that is felt by that emotional presence, that support, care, love that is given by that primary giver, that primary caregiver enforces that secure attachment, and this secure attachment will shield them from these mental disorders. But if they do not have that secure attachment and they end up in the situation called insecure attachment because of neglect, abuse, they have a higher risk of developing these mental disorders that we looked at in the earlier slides. Then we have other factors like poverty, because poverty causes a lot of things. It might limit your access to basic needs, but also access to mental health services. Then we have peer rejection and bullying. During this stage, you're trying to make friends with the people around you. So if you are rejected in those groups, if you are bullied by maybe people who are older than you at school or within your social circles, then you are at a higher risk of developing also these mental disorders. Then sometimes there is a problem of poor academic achievement. So if you do not achieve the best grades in school as a child, you feel low, and especially when you do not um, get support from or reassurance from the person around you, especially your parents or your friends, then you end up being at a higher risk of these mental health disorders. Then in adolescence, the risk factors to these mental disorders that we have looked at include pressure to conform with the friends around them, and also exploration of identity. Like we're saying, according to the other mental development theories, and in this case, I think it must have been the one of Erickson, which talked about that conflict in this stage of adolescence. You're trying to identify who you truly are, but there is also a chance of you not getting to know who you truly are and ending up in other circumstances of drug abuse and other self harm behaviors. So the pressure to conform with peers, but also exploration of identity, can be a very big risk factor for mental disorders, especially in adolescence. Then media influences. We are living in an information era where media influences how we behave, how we perceive life, and the beliefs that we are going to have. So people who watch celebrities on TV, TikTok, they want to mirror, or they want to also act like them. And sometimes when they are unable to do that, they end up with these mental disorders, you know. Then we have gender norms. These are pressures that that could be that society has placed on individuals by virtue of being male or female. So the male child is always expected to be strong, even when they are faced with those emotionally uh, heavy situations. They are expected not to shed tears. They're expected to be strong in that regard. So such norms, such gender norms always can predispose or can be a risk factor to these mental disorders. Then ladies or the female adolescents in this case, they're always expected to be submissive. So that means that they are at risk of some of these abuses by their male counterparts who could be older. So if someone is older and you are expected to be submissive, if they come in with their sexual advances, you're more likely to give in. And when you give in, this can be a risk factor for a mental disorder. So those gender norms um, come into play and can be a very big risk factor for mental disorders during this adolescence stage. Then we have poverty, like we're saying, it limits our access to basic needs and is a big risk factor here. Violence, both sexual and physical. We have lack of quality support and care services in regard to mental health. We have adolescents living in fragile or humanitarian settings like refugees or internally displaced people that are also at a greater risk of developing these mental disorders. Then pregnant adolescents are very are also at a very high risk of developing mental disorders. Remember, when you become pregnant, when you're an adolescent, you do not have support from your family, you do not have support from the person who has caused that who has impregnated you. So during that stage, you can feel anxious, you can be depressed, and all the other mental disorders can come into play. Then after pregnancy, when you have delivered and you have become now an adolescent parent, then you also are at a very high risk of developing these mental disorders because the pressure of raising now the child comes into play. Okay. uh, Limitation of resources, being cast out by your family because you are now a parent and you should live on your own. So all these pressures can be a big risk factors for mental disorders in adolescence. So the common interventions during these stages of adolescence in and childhood for us to deal with mental disorders in these stages, we always use play therapy. So play therapy is very essential in trying to understand some of those messages that children might want to put out there, but sometimes it is hard. They feel uh, anxious, they are fearful to communicate to the people around them. So by use of play therapy, they can be able to put these messages out there. The way they interact with these toys that are provided to them during play therapy can tell you whether they are having a problem or not, whether they are having a problem with the people around them or not, and how you can deal with these problems. Then family therapy enables us to communicate well with the families that in from which these children and adolescents are coming from, but also creating a better environment for these adolescents and children to be in, an environment that is free from conflict and can be understanding uh, and accommodative for these children and adolescents having mental health concerns or challenges. Then individual psychotherapy, or what we are calling the talk therapy according to Sigmund Freud in the other mental health development theories emphasizes on talking to this person, so that they can voice their concerns, they can tell you the problem that they are facing. Okay. Then we have specific programs like the Stop, Think, Do program, which focuses on dealing with anxiety, and then also using friends to help these individuals deal with these mental health problems. We have medical interventions, use of medications like antidepressants, psychostimulants, and antipsychotics. Depending on the condition, you can use these medications. Of course, they should be prescribed by a professional physician or a mental health professional, so that you do not end up treating something that is not right, or treating it in an incorrect way. Then we have behavior therapy, which premises on the fact that since behavior is learned, then we can also learn how to cope with these challenges that come with mental disorder. So if we are saying that we learn behavior, especially according to Albert Bandura, that we learn behavior, but also according to these to people like Ivan Pavlov and B.F. Skinner, they say we learn behavior from the environment, and this behavior is reinforced through rewards, and can also be diminished through punishments. So behavior therapy comes in and says, if we want to stop some behavior that is mentally damaging, or that is related to mental disorders, then we can put in place punishments, or we can stop reinforcing such behaviors. So that is how behavior therapy works, but also goes on to make these individuals having mental health problems understand how they behave, and what causes their behavior, and how they can deal with these behaviors, but also how they can react to these beliefs that cause them to behave the way they do, so that they can have better mental health outcomes. Then individual education planning to help individuals who are having problems with learning, or uh, facing issues in their education due to these mental health disorders. Then we can also have specialist teams to deal with those specific mental disorders like autism, like uh, attention deficit hyperactivity disorder, and the others. So there are those specialist teams which are concerned with those um, individual mental disorders, and they can be helpful to deal with those disorders. And then we have the principles that enable us to deal with these mental disorders in childhood and adolescence, and these include aspects like this: a strong and flexible engagement focus. We should be flexible in terms of how we deal with these disorders in the adolescents and the children, because these are delicate kind of age groups, and we need to be flexible in how we deal with them, so that they can get the best care from the mental health services that are delivered. Then comprehensive assessment, by looking at all the risks that are concerned with the development of these mental disorders in children and adolescents, so that we can holistically look at this individual that is suffering from this mental health disorder. We can look at the risks that are to do with their upbringing, their social environment, their challenges with at school. So it should be a comprehensive assessment so as to tackle everything that could be leading to this mental disorder. Then multidisciplinary diagnosis ensures that we we take advantage of every discipline that is concerned with this adolescent or child that is having a mental health disorder, whether it is at school, you know, whether we are going to use the religious people, whether we are going to use the parents, and then also the mental health practitioners to diagnose and fully treat or manage this mental health disorder in a child or an adolescent. Then real world interventions focus on the context in which this adolescent or child is in, so that we can have those culturally sensitive interventions. Okay, then multifaceted interventions look at all the dimensions or all the facets that can be utilized or can be focused on when you're dealing with these mental disorders. For example, the social aspect, the psychological aspect, the biological aspect, the environment aspect, all of those should be focused on when dealing with these mental disorders. Like we realized in the frameworks of mental health, we saw that these mental disorders do not arise because of biological, just because of these biological factors, but they can arise due to a combination of all those factors coming into play: the biological, the psychological, the social, the environment. So when you tackle these mental disorders in adolescents and children from those multiple facets, then you can be confident that you are going to have a holistic kind of mental health care and a good mental health outcome. Then we also need to ensure that there is early detection and treatment of these adolescents and children when we are doing this mental health practice, so that we can promote better outcomes, but also prevent the worsening of some of these mental health disorders. Then outreach and enrich models. When we talk about outreach, we we are referring to the fact that these mental health disorders should be taken outside the the hospital confinement. Okay, we shouldn't always wait to for these individuals or adolescents to come to the hospital. We can go outside, we can go to these schools where they are, we can go to the communities and educate them, also identify these individuals who need these services, but also enrich, making sure that inside the hospital confinement we are having robust um, mental health services to deal with these mental health challenges that are faced by adolescents and children. All right, so that was a very critical age group of adolescents and children. And now we look at another critical age, which is the old age, people who are 60 and above. Okay, those people that we are most concerned about, because as the population transitions, as we have less people dying because of infectious diseases, as we have more people surviving because of better health services, then we are going to have more people growing older. Okay, so you can imagine in 2020, 1 billion people in the world were aged 60 years and above. And according to those projections, according to the projections by World Health Organizations, by 2030, which is just a few years from now, about 5 or 6 years from now, that figure will rise to 1.4 billion. So in 2030, we shall have 1 in 6 people worldwide being 60 years and above. And This will even increase further. By 2050, we shall even be having more, 2.1 billion according to the World Health Organization. So that means that this age group is of is of great concern, especially in the public mental health arena. Okay, because the most common mental health concerns in this age group are depression and anxiety, but also we have other disorders like dementia, we have substance use, and also suicide. So, what could be the risk of mental health disorders among the elderly? The people who are 60 years and above, what causes or what is the risk factor? What puts them at great risk of developing these mental disorders? So there could be exposure to adversity. This includes bereavement or losing a loved one. So you find that by this age, or people who are 60 years and older tend to lose their loved ones, whether it's their children, whether it's their friends, it's their spouse. Because of growing older, they are at risk of losing their loved one, and they keep on losing them. Maybe their friends, as they grow older, they keep on dying. So this bereavement tends to put them at risk of these mental disorders. Then abuse from caregivers. So in most cases in our families, we leave these people to the mercy of the people who care for them. We perhaps hire someone to be taking care of this old person, to always dress them, clean them, and take care of their requests. But sometimes these caregivers end up abusing them. Okay, end up abusing them either physically, by beating them. They end up abusing them sometimes sexually, by raping them. Sometimes they end up abusing them psychologically using those verbal abuses. So all this exposure to adversity can be a risk factor for mental disorders among these people. Then reduced levels of income because they have retired, they do not have a stream of income, and on top of that, sometimes they are not receiving any support from some governments or even the people around them. So reduced level of income and the inability to get the basics of life that they need, they can be a big risk factor for mental disorders among these people. Then we have reduced sense of purpose due to retirement. We have social isolation and loneliness because they stay alone, because they are isolated from the public. Sometimes they end up having these mental disorders. Then we have chronic health conditions that come in because of old age. We have lack of access to support and care services, and even when the care services are there, these individuals who are of 60 years and above tend to be discriminated against. They are not attended to the way the other people are given the attention. Okay, and then some of these elderly end up using substances like tobacco, alcohol, which can be a main risk factor in mental disorders. Then elderly also living in humanitarian settings are at a greater risk of suffering from these mental disorders. So the mental disorders that are of concern, like we're saying, are those depression, anxiety, but also dementia and others that we are going to see. So, for example, in dementia, which involves the deterioration of intellectual function, thinking abilities, the power of reasoning, leads to progressive impairment in thinking, memory, behavior, personality, and motor function. The key effect of dementia is that loss of memory, you know, the inability to remember certain things, is one of the key things here. And the types of dementia include Alzheimer's disease, which accounts for 50 to 60% of dementia cases. Then we have multi-infarct or vascular dementia. We have alcohol-related, and also Pick's disease. Then we have risk factors for dementia being ultimately age. In old age, dementia is more common. We have serious head injuries that could result from either trauma, from accidents, but also boxing and other sports that can damage your head. Um, then it is majorly caused by degeneration of the cerebral cortex, including death of the brain cells, and which and conditions that affect the vascular or those blood vessels and nerves that supply or that are around the brain for its survival. So Alzheimer's disease, like we are saying, is the most common form of dementia, and it is hereditary in nature, or if you have the history of having Alzheimer's disease in your family, then you are at greater risk of having the same disease in future. So it is characterized by loss of brain cells due to abnormal protein deposits. So these protein deposits in our brain destroy the brain cells and lead to lower neurotransmitter levels, which remember these neurotransmitters are the ones which control important brain functions. So when there is this abnormal deposition of these uh, proteins, we have loss of those brain cells and lower levels of neurotransmitters. So the early signs in Alzheimer's disease include diminished short memory, but in severe cases, or if it is not treated, if it is not managed, of course, Alzheimer's disease cannot be cured, but it can be managed. But if it is not well managed or if it is not detected early, we can have inability to perform those daily activities in these old people. Then we have diagnostic processes. How do we know, or how do we get to confirm that it is Alzheimer's disease? We can use techniques like a physical exam. We can use a complete medical history by asking how these people feel, what happened, when did it happen, information concentration orientation test, and then a mini mental state exam. Treatment focuses on symptom control. Since it cannot be cured, we look at how we can resolve the symptoms, and then addressing underlying diseases that could have caused this Alzheimer's disease or disorder, and then considering long-term care options involving physical exercises, involving psychotherapy or talking to these people, and also social support from the people around them so that they do not feel bad about this condition, and it can help them to live quite a normal life even with a disease. Then other types of dementia, like we had highlighted, include that vascular dementia that is caused by poor blood circulation to the brain and is often linked to tiny strokes or bursting of those blood vessels that supply the brain. Then we have Lewy body dementia, which is caused by abnormal protein deposits also, and share symptoms with Parkinson's disease and Alzheimer's. So Parkinson's disease is concerned with that it is also about is common in old age, and it limits or impedes the person's ability to move. So it affects the movement of these old people, but also affects their mental health. And then we have alcohol related dementia, which is due to excessive alcohol consumption. Um, Recovery may involve quitting alcohol. Then Pick's disease, another form of dementia, which is rare, is caused by uh, a damage of the cells of the brain in the frontal part, or the one which is called the frontotemporal lobe of the brain, and this will cause behavior and personality changes, which comes before you lose your memory. So all these types are concerned of dementia are concerned with memory loss, which is the chief sign or symptom of dementia, and it is very common in people who are of 60 years and above. Then delirium is also a condition of severe confusion. It is also characterized by disorientation, rapid changes in the brain function, your ability to think and reason, and often temporary and reversible. So this one is more of a disorder than a disease. Can occur for a short time, can be resolved. So the causes include disorders that deprive the brain of oxygen, infections like sepsis, you know, uh, urinary tract infections also can lead to delirium if not treated very well. But also pre-existing brain damage due to trauma can lead to this confusion that we are calling delirium. Symptoms include rapid alterations between mental states, disrupted attention, and disorganized thinking or altered consciousness. So it is a bit different from dementia, because already it involves that disrupted attention and altered consciousness, or you are not in touch with reality. Okay, so that altered consciousness and disrupted attention is what makes it different from dementia. Then treatment or management focuses on controlling or reversing the underlying cause. So if the cause is an infection, treat that infection, and this delirium will be managed effectively. Then also creating a safe environment that promotes healing from this delirium and possible hospitalization, especially in these people with old age, so that you can manage but also monitor the recovery of this person. All right, so those are common the common mental disorders in old age, but we realized that we also talked about issues of depression, of anxiety, which we are going to expound on right now. So the other mental disorders now we are going to look at are those that affect us uh, in our adult life, okay? Not just in childhood or adolescence or in old age, but in our adult life we face other disorders. All these disorders, you will find them in the community amongst people of all ages, okay? So we have disorders like schizophrenia, we have bipolar disorder, we have depression, we have anxiety disorders, personality disorders, post traumatic stress disorders. We have other disorders like the eating disorders, substance use disorders, sexual disorders. All these are mental disorders that are of concern to to the public mental health professionals like us, and an understanding of them makes us know how we can manage them in the community or the people around us. So schizophrenia, according to World Health Organization, affects 24 million people worldwide. That means that 1 in 300 people have schizophrenia. This is according to the World Health Organization data in 2019. So the risk factors of schizophrenia include neurotransmitter imbalances, which is a biological factor, family history, like we keep saying, if someone in your family ever faced schizophrenia, then you are also at risk of having the same disorder. Then we have drug abuse, some psychoactive drugs like nicotine, which is found in tobacco or cigarette smoke. Then we have drugs like cocaine, heroin, marijuana. All those are psychoactive drugs, and they could be a big risk factor to schizophrenia. Then we have pregnancy and birth complications like low birth weight, premature labor, and malnutrition during childhood can lead to this schizophrenia in future. Signs and symptoms include persistent delusions, which are basically those false beliefs that people have that this person will be having. So this in schizophrenia, you will be having that false belief that for example, someone having this could say that I am the president, maybe of South Sudan, when they are actually not. They also they might also be believing that someone is talking to them when in actual sense this person is not there. Then hallucinations, they can see things which other people cannot see, they can hear things which other people cannot hear, can say it is raining when it is actually not raining, someone is talking to them when actually that person is not there. They are seeing some things which other people cannot see, and that will be a hallucination. Then they have disorganized thinking, disorganized speech. They speak words which are not coordinated, and then they have highly disorganized behavior. Okay, so all these are signs and symptoms that you can look out for to know that this person is having dementia or is having schizophrenia, sorry, or not. Persistent delusion. So you might be having a problem with your thinking, but if it is not persistent enough, if it doesn't last long enough, for example, at least 2 weeks, then you might not be considered to be having schizophrenia. So the key element of these disorders is that persistent uh, is that persistent kind of nature of these disorders, the persistent delusions, persistent hallucinations, persistent disorganized thinking, disorganized speech, and disorganized behavior is what we look for us to tell that this is schizophrenia or not. Then how do we treat or manage this schizophrenia? It can be managed through medication, which of course has to be administered by a professional psychiatrist or a professional mental health physician. But we can also utilize talk therapy, or what we call psychotherapy, where you talk to this person. This always comes after medication, because these schizophrenic people, sometimes they are aggressive, so they have to be first calmed down by these medications. So after they are in that calm state, then now you can administer your talk therapy, family therapy, like we talked about, or cognitive behavior therapy that focuses on improving the way they think, improving the way they can handle their emotions, but also take control of their behaviors. Then we have bipolar disorder. which affected 40 million people globally in 2019, according to World Health Organization, and it is characterized by that alternating uh, fashion of depressive episodes and manic tendencies. So on one side you're having depression, on the other side you're having mania. So in the depressive mode, the individual will feel sad, will feel irritable, will feel empty, and will not be able to derive pleasure from interesting activities, those activities that once gave them pleasure. For example, watching TV, going out with friends, having sex, playing games. So those activities that used to give you pleasure are no longer giving you pleasure if you are depressed. Then in mania, you are having a lot of excitement, or what we are calling euphoria. You're having increased activity and energy, increased talkativeness, increased self-esteem, decreased need for sleep, and impulsive behavior, or that behavior where you act without thinking. So this individual with bipolar disorder will have alternating episodes. Okay, one time they are feeling sad, another time they are feeling happy. One time they are feeling empty, or or unable to derive pleasure in those interesting activities. Another time they are feeling uh, very happy. They do not want to sleep. They are feeling um, impulsive. So that alternating kind of situation between depression and mania is what we are calling bipolar disorder. And if that alternating that alternating those alternating episodes are persistent for more than 2 weeks, then we are going to say that this person is having this bipolar disorder. The risk factors include family history, which we have to keep on emphasizing. We have drug abuse, for example, alcohol and other psychoactive drugs, like we talked about, the cocaine, heroin, and marijuana, and others. Then we have highly depressing events like loss of a loved one. You might think that it is going to cause only depression, but it can also bring in periods of mania where uh, you feel hyperactive, you feel uh, euphoric, you have increased self-esteem. So when you have that alternating kind of behavior between depression and mania, then you are going to be having what we call um, bipolar disorder. Treatment focuses on psychotherapy or talking to this person, but this should be after medication, especially if the symptoms are very terrifying. So you first administer medication to calm this person down, and then you give psychotherapy or talk therapy. Then also behavior therapy. Then sometimes, if these um, interventions are not working, especially medication, or if this person is pregnant and they cannot take some certain medication, then you use what we are calling electroconvulsive therapy. So in this case, an electric current is passed through the head of this person so that it induces a seizure. A seizure is more of like that increased activity in the brain, uh, or increased impulse uh, transmission in the brain, and this seizure will cause resolution of these symptoms. So that is electroconvulsive therapy, which can be used when medication has not worked or is contraindicated, especially in individuals with pregnancy, or in individuals where it is not working. Okay, then we have depression, which affected 280 million people. 280 million people in 2019 were depressed. This includes 23 million children and adolescents. Wow, this is a very big number. 280 million people. And depression differs from mood fluctuations and short term emotional responses to challenges in life. It is characterized by feeling sad, um, irritable, empty. You also lose interest in those pleasurable activities like we talked about in bipolar. Now, in depression, you do not have the other phase of mania. You only have this depressive phase, okay, which persists for at least 2 weeks. So, other symptoms include poor concentration, feelings of excessive guilt or low self worth, hopelessness about the future, suicidal thoughts, disrupted sleep, changes in appetite. So we are saying changes in appetite because some people uh, end up eating a lot or eating little or not eating at all when they are depressed. So there are those changes in appetite. The risk factors can be biological in nature due to neurotransmitter or hormonal imbalances. Then we have family history. We have certain personality traits that can be of a greater risk to depression. We have trauma, have chronic illnesses such as cancer, which can make you lose hope in the future and end up being depressed. We have drugs which are abused, especially alcohol and substances, especially alcohol. We have certain medications like blood pressure medications, sleeping pills, which, when used in without moderation or without the correct advice from medical practitioners, can lead to depression. Treatment can be of medication type where they use antidepressants or other drugs like selective serotonin reuptake inhibitors, which help in minimizing the symptoms of depression. Then we also can use talk therapy or psychotherapy, and if the medications are not working very well or they are contraindicated, especially in pregnancy, we can use ECT, or what we called electroconvulsive therapy. So, electroconvulsive therapy, like we said, uses electric current that is passed into someone's brain or someone's head, and it triggers a seizure that will lead to resolution of these symptoms or making the person better. Then anxiety disorders, according to the World Health Organization, it was reported that 301 million in the world were living with anxiety disorders in 2019, and this included 58 million children and adolescents. Very big number there also. Anxiety disorders are characterized by persistent, note this very well, members, ladies and gentlemen, note this word of persistent. So a disorder or a mental disorder has to be persistent to be called so. You know, if you have, if you're feeling low today and the rest of the week you're fine, you cannot say that you are depressed. Okay, if you are unable to derive um, pleasure from those interesting activities for one day, but you are fine for the rest of the week or the month, then you cannot say that you are depressed. But that persistent, or the one that occurs for more than 2 weeks, so is what we are calling a mental disorder. So in this case, it is characterized by persistent excessive fear and worry, unrelated behavior disturbances, the most common types being GAD, or what we are calling generalized anxiety disorder, which is characterized by excessive worry. Then panic disorder includes those panic attacks that will involve racing heartbeat, uh, inability to breathe well, and this could be either due to an impending uh, uh, an impending event like an exam, So those panic attacks are what constitute the panic disorder, which is another form of anxiety disorders. Then we have social anxiety disorders, which are excessive fears and worries about social situations, or those situations which involve you either talking or interacting with other people in a group. Then separation anxiety disorder, we had talked about it in our previous sessions, which is concerned with excessive fear or worry about separation from those individuals to whom the person has deep emotional bond. It could be a parent, it could be a loved one, it could be your spouse, it could be your friend. All right, treatment focuses on use of medication, relaxation techniques, mindfulness, CBT. Physical exercise can also help in anxiety, but also avoiding alcohol can be very essential in managing your anxieties. We also have personality disorders, which are very many, but they are concerned with our personalities, and they are hard to manage because we tend to live with them and feel normal about them. We do not think that there is a problem with personality disorders, but uh, we shall realize that there are problems related with them. So their personality is essential for defining who we are as individuals, and it involves a unique mix of traits such as thoughts, attitudes, and behaviors, as well as how we express ourselves during interactions with people around us. So personality disorders cause distorted perceptions of reality, they cause abnormal behaviors, and they cause distress in relationships at work and in other social fora. So the most common ones include paranoid personality disorder, or what you can call paranoia, and it is characterized by mistrust or and suspicion of others without sufficient reason. So if you are that person who doesn't trust, or you are always suspecting people of causing harm to you, you are always thinking that someone is against you, someone is going to cause harm to you, even when there isn't any history or any reason to suspect them, then you are having this personality disorder. But it should be persistent, okay? It should be persistent in nature, that you have been like this for a very long time. Then we have schizoid personality disorder, that is concerned with consistent detachment and disinterest in interpersonal relationships. We have schizotypal personality disorder, which involves intense discomfort with and limited need for close relationships. So this one has is always not comfortable with people coming close to them. And then antisocial personality deals with the lack of respect for others, or not being able to follow social norms or orders from the people that are in authorities, or other people that are around you. Okay, so that is the antisocial personality disorder, because in society we always have those norms, okay, that define how we behave, how we interact with others respectfully. But this person who does not follow those norms, who has disregard for these norms, is having what we call an antisocial personality disorder. Then borderline personality disorder has issues to do with difficulty in emotional regulation, leading to what we call mood swings, low self esteem, acting without thinking. The one that we are saying is called impulsive behavior. Then relationship difficulties, because this person is having mood swings. At one time they are happy, at the other time they are not happy. They cannot have a very successful or productive relationship with others. Then histrionic personality disorders is the one that is characterized by a distorted self image. Their self esteem is dependent on the approval of others. You cannot uh, have that self worth. Okay, in histrionic personality disorder, this person depends on what the other people think of themselves. Okay, of this person. Okay, you have to seek approval, or you have to be told that you look good, you are doing well, you are a good person. You do not know this by yourself. You have to be told by the other people, or you have to be approved by others, and that will be the histrionic personality disorder. Then narcissistic personality disorder is characterized by excessive need for praise and admiration, and a lack of empathy for others. So it also originates from that low self esteem, because you do not think yourself as being self worth, or you do not think of you being an important person or being worthy. You have to seek praise. Okay, you need people to praise you, you need people to show a lot of respect to you, and this can sometimes cause you to lack empathy of others. Okay, and this will be the narcissistic personality disorder. Other disorders include the avoidant personality disorder, characterized by intense fear of being judged or rejected by others. Dependent personality disorder, where the person cannot make independent decisions of their own. They are also submissive in nature. They have excessive need for constant reassurance from others, and they need to be cared for by someone else. They cannot take care of themselves for long. Then obsessive compulsive personality disorder is characterized by consistent or persistent excessive need for orderliness, perfection, and control, with no room for flexibility. These are the people who have a way of organizing their books, a way of organizing their bed, a way of organizing their clothes, so that if there is any slight distortion, they feel anxious, they feel irritated because of that. They are always in need of that specific orderliness, and there is no room for flexibility. The people who, even when COVID is gone and it has been declared, we are declared free of that COVID, they are always sanitizing themselves. They do not need they do not want any germ to come to their hands. They are always very orderly. They are perfectionists. So without any room for flexibility, and this will be called the obsessive compulsive personality disorder. So treatment of these personality disorders, as highlighted earlier, is a problem, because people feel uh, it's normal to be with them. They feel there is no problem with being obsessive compulsive, of being dependent, of being avoidant, of being histrionic in nature, of being narcissistic. They do not see any problem, but if you can recognize that there is a problem, then there are options like psychotherapy or talk therapy, medications to manage anxieties, especially the ones that we saw in panic disorders, then also depression uh, that can arise from these personality disorders can be managed using medications. Okay. Then the last disorder that we are going to look at is the one that we are calling post-traumatic stress disorder or PTSD. It is of great concern, especially in our setting, because we are living in a country which uh, has just faced those traumatizing events, those life-threatening events, and the memories of these events can lead to this disorder that we are calling post-traumatic stress disorder. And it is characterized by those intrusive memories, flashbacks, anxiety, and nightmares about these traumatic events, avoidance of activities, situations, or people that can remind you of these events, and then persistent perceptions of heightened current threat. You feel like these events are going to come back. If it is a bomb, if it is those a gunfire, you feel like it is about to happen again. So treatment of this PTSD focuses on trauma focused CBT or the behavior therapy that focuses on improving the way you react to these emotions, these thoughts about those traumatizing events. Then eye movement desensitization and reprocessing therapy focuses on use of your eyes. So the physician will train you on how on by use of eye movement in specific ways as you process these traumatizing events. All right. So those are the mental disorders of concern. Of course, there are very many more, like we said, and I will encourage you to dig deeper and discover more mental disorders, their risk factors, and how they can be managed, especially at community level, and how they are of concern to public mental health. So, mental health and legal rights. The key concepts in this session, in this section, include mental capacity, which is the ability to make informed decisions about one's life. Involuntary commitment deals with the legal process for detaining individuals deemed to be a danger to themselves or others due to mental illness. And criminal responsibility is the ability to understand that what you did is wrong and stand trial. Then mental health treatment rights concerned with the right to refuse and consent to treatment, ensuring autonomy and respect for personal dignity. Like we highlighted in our first session, even when someone is mentally ill, they do not cease to be human. And that means that they should enjoy human rights. So that is why we are talking about mental health treatment rights, the right to autonomy, the right to refuse treatment, the right to personal dignity. Sometimes these rights conflict with the right to the need to protect the greater community, and that is why we talk about mental health and legal rights. So balancing rights and safety can be very challenging, you know. So we look at how do we protect autonomy of these individuals, the fact that they need to make their own decision to either take on medication or these mental health services, or if we can if we can allow them to have privacy, or not. Then ensuring community safety is also another concern, where we need to balance the personal freedom of either declining to receive mental health care, or protecting the individuals that are around them from harm. Because sometimes, especially in these conditions that are very intense, like schizophrenia, these people can harm themselves or harm the people that are around them. Okay, because they have those disorganized behaviors, like we saw. They can be a danger to the people around them, and yet we have to protect their rights, so it can be something which is challenging. Then list restrictive alternatives. Okay, so this is aimed at seeking the least intrusive intervention necessary to achieve those necessary goals. Do we have to shackle them? Do we have to tie them up, you know or do we have to let them decide whether they need this treatment or not? But remember, we have to also take consideration of the people around them, so that they do not cause harm to these people. So that is why there is that balance that needs to be taken care of. Then the role of mental health professionals in providing expertise to inform legal decisions and support individuals and navigating the legal system. So sometimes these individuals engage in behavior that harms people, and they are taken to the courts of law. So they need these mental health professionals to inform these courts of what could have led to that behavior, so that the courts of law can really understand the gist of the matter from that perspective. So exploring legal frameworks or the global context in this aspect of legal rights and mental health, we recognize that their civil and criminal systems are different, and in different countries we have different approaches to involuntary commitment, or how people can be taken to be tried because of the harm that they have caused to the community or the people around them. Then model codes and standards, the guiding principles for implementing mental health laws with human rights protections. Okay, evolving trends that focus on recovery oriented practices and community based care. All right, so this is what is very important in the legal rights aspect of mental health, that we need to know that even when they have rights, they have human rights, these people who are having mental health illnesses or mental health disorders, but we also need to protect the public. Okay, so striking the balance between protection of these of the human rights of these individuals and also protecting the public will make sure that we have a better legal framework that can be focused on creating a better environment for these individuals, but also uh, the public itself. And we should also make sure that we focus on issues to do with equity, so that everyone everywhere can access these mental health services without being discriminated against, without being stigmatized, but also they are affordable and accessible, and they are part of the primary healthcare package of each and every country or society. So, in conclusion, we have looked at these different disorders. There are very many, and they are of different types. And we recognize that for us to deal with them, we need to always take care of those critical periods when we are growing up, when we are in adolescence, when we are in old age. What do we need to do at individual level, at family level, at community level, so as to shield ourselves from these mental health disorders that we face, whether it is secure attachment, whether it is support for you to identify yourself during that period of adolescence, whether it is social support and care during old age, whether it is quitting substance use, behavior change, talk therapy, and the use of medication. Sometimes it all those interventions are very essential in ensuring that we have better mental health outcomes and a better mental uh, health system for our country. So thank you so much for joining me today, and we'll catch you on the next one.